We need to get back on topic, and that's the fact that health insurance, one, exists, and two, that it's as expensive as it is, but still could potentially not cover everything. And I don't know why no one wants to stay on that topic. Hello. Welcome to my channel. My name is LA. If you are new here, thank you for stopping by. If you are someone who was here and has seen another video and decided to return, thank you for coming back. Just a quick disclaimer, this video is all based on things I've either read or seen in videos or YouTube, news, press, whatever. And it's all my own opinion. And my opinion is subject to change. And everyone's entitled to have their own different opinion, but this is my own personal analysis based on things that I have read or seen. So we're going to talk about who Luigi Mangione is. And I think I said his name right. But he is the person who has been arrested in connection to the death of Brian Thompson, who was the CEO of United Healthcare. So the first and foremost, the arrest was peaceful. As far as I know, that's what they said in a press conference. It was peaceful. He was recognized by his eyebrows. He does have very, very prominent eyebrows. Like his picture's in the thumbnail if you've not seen him. That's how he was recognized. And he took a bus out of New York City, and he was found in Pennsylvania at a McDonald's. Now, I'm not clear on if it was a McDonald's worker or customer that called him, or it was like a combination of the two. But it was someone at McDonald's that called on him. He was originally arrested for having a fake New Jersey ID. So his original arrest was a forgery charge. But he has since been charged with the murder of Brian Thompson. But they also were able to identify him because he had his passport on him. And he also had documents criticizing the health care companies. I think it was just health insurance. I don't know if it's like hospitals too, but I know it's probably at least health insurance companies. I'm not clear on if it's just United. I don't think it is. It sounds like it's just in general. But he also had a 3D printed firearm and suppressor. So because they were 3D printed, probably he made them himself. Probably. That means that there's no serial number, so it can't be traced. So that's a little bit of background of him in terms of being arrested. Now, something else about him too is that he graduated from the University of Pennsylvania. He has a bachelor's and a master's degree. He was the valedictorian of his high school. I believe his high school was a private one. It came from a pretty wealthy family. So this, he doesn't really fit the stereotype that a lot of people would think that he would fit for someone that would do this. Like even in my last video, I said that this is probably someone who's been denied health insurance, or someone he knew or was related to probably couldn't cover their costs. And that may not be the case based on what I have discovered and what I've read here. So that's a little background on Luigi Mangione. And I'll give more updates on him as this case obviously progresses. I believe that because it's 2:52 right now, I think actually since I started filming this video, I think he has officially been charged with the murder of the CEO. But originally he was arrested for forgery charges. But I do want to talk about someone I mentioned earlier already. That's the Pennsylvania governor, Josh Shapiro. For two reasons. One, he condemned the celebrations of the murder of Brian Thompson, which I agree with. And I said that in my other video, and I know some of you may not like that I feel that way, but I don't agree or support his murder in any capacity. I just don't, because I don't believe that's how you go about things. But he did make a claim in his press conference, and I wrote it down word for word, and this is in relation to how we do things here in America, not anywhere else, just here in America. He said, "We do not kill people in cold blood to resolve policy differences or express a viewpoint." The first half of that I agree with, about the policy differences. Kind of don't agree with the second part where he says express a viewpoint. I think it's been pretty clear in the past few years that this is actually how a lot of people express their viewpoint. Now, if he meant it in the sense that we don't condemn it, or we don't condone it, then yes, I would agree. But it didn't sound like that's what he meant. And I kind of sat there thinking about it for a little bit. I was just like in bed. I was crocheting my son's baby blanket. And I'm thinking like, this guy's talking a lot about himself, because after he made that comment, he started talking about things that he did during his campaign and while he was in office to lower, I guess, costs, whether it's related to health insurance or just healthcare in general. And he's not the only person that's done that so far. I think like even on that law and crime video, and I'll link it in the description if you want to go see it, they do an interview, I believe, with a lawyer who also is a little self-righteous. And I'm like, these people are not very good at staying on topic, are they? The topic is not your campaign. The topic is not the people calling their heroes. The topic is not like condemning viewpoints. The topic here, whether we like it or not, are costs in health insurance and costs in health companies. And we have got to, as Americans, we have got to stop letting policymakers and politicians, businessmen, whoever, we have got to stop letting them get off topic by trying to talk about, well, this is what we stand for. I don't condone this. Like, that's fine if you feel that way, but we need to get back on topic. And that's the fact that health insurance, one, exists, and two, that it's as expensive as it is, but still could potentially not cover everything. And I don't know why no one wants to stay on that topic. That's what this is about. At least right now, that's what people are talking about. That's what I think it's about. This has gone from someone murdering someone just for what they do for a living, because at the end of the day, that's really what he did, to politicians and lawyers and police departments trying to cover themselves, pat each other on the back, tell everyone their own accomplishments. And like, none of this has anything to do with what anyone's concerned about. This is like, we need to stay on topic about our health insurance. And because we turn to an industry, we get nickeled and dined to the point where health insurance companies try to figure out how they don't actually have to pay. So if you don't know anything, like if you're not a business savvy person, I have an MBA, so this is just business in general. The whole point of business is to maximize profit while keeping costs down. And that's what health insurance companies are doing when they deny people's claims. I think it was on Reddit. I saw a story recently, I think it was yesterday, where someone was talking about how they needed an inhaler and their doctor prescribed a specific inhaler. And I don't think United was their company, but it doesn't matter. They sent the claim in and they wouldn't pay for it. They said, no, this is too expensive. You can have this inhaler. And so they're trying to use this inhaler that doesn't work, even though the one that their doctor gave them prescribed does work. And they couldn't use it because their health insurance company said no. And the fact that this is just being completely avoided by politicians right now is crazy. And it's especially crazy considering Anthem just pulled a gigantic Uno reverse card, like a huge one. They decided that they weren't going to cover anesthesia past a certain point in a surgery or a procedure. Now, anyone that's had any type of surgery, I've had different surgeries. I've had my tonsils out when I was 2. I've had a C-section. I'm going to have another one next week. And I've had my wisdom teeth taken out. Now, we all know that all 3 of those require anesthesia, right? They would basically tell me that you've gone past this time, so we're no longer covering it past this time. And now after this, what happened with United Healthcare, Anthem's all of a sudden just saying, oh, just kidding. We didn't mean it. We're going to change our minds on that. But if this hadn't happened, I don't know if Anthem would have done that. I really don't. And like, it's sad to say that that's what had to make them change their mind. I don't know if that's what changed their mind, but they reversed it. But even still, Anthem's in an argument right now with Ohio State University, OSU, like, OHIO. And they are in a disagreement with them because they're raising their rates. I'm actually going to read this to you off of my phone. This was dated December 8th, 2024. Patients at the Ohio State University Wexner Medical Center were notified that their coverage from Anthem Blue Cross Blue Shield insurance may be removed from the network on January 1st. Now, this next part is in the same article, but it's about someone who got treatment there when she was pregnant and with her, I guess her daughter's 1 year old now. This is what she says. She says, you feel really uncertain because all of a sudden you are left wondering, do I need to find new medical care? If we were to have another pregnancy, what would my medical care look like and who would I go to? So because Anthem and Ohio State can't get it together, this is what people are going through. This is the reality. And this is just one person. So what's the issue? The issue is that, this is a quote from the article from Anthem. We are concerned that OSU wants to increase its prices for patients and their employers at rates 3 times higher than inflation. These price hikes would increase healthcare costs for Central Ohio by $185 million over the next 3 years. Ohio's consumers and employers who would pay these cost increases cannot afford these extreme price hikes. Now, this is what Ohio State says in response to that. Anthem has underpaid us for the past few years, failing to keep pace with inflation. While Anthem consistently raises employer and member premiums, They have not invested into patient care at the same rate. Our costs to deliver care have risen 45% in the last 5 years, and unlike other insurance providers, Anthem has refused to consider appropriate rate adjustments so the healthcare providers their members trust can cover expenses. So this is what I'm talking about. Remember when I said in the last video that we get caught in the middle because companies and hospitals and insurance can't get it together so that we can get our medical care? This is what's happening in real time. This was December 8th. Today is December 10th. That was 2 days ago that this article was published. This is what we're talking about, why we need to stay on top of it. We cannot keep letting politicians like Josh Shapiro go off on a tangent about his campaign, or lawyers talk about the person who called in on this Luigi Mangione guy as a hero. That's not, okay, that's fine, but can we get back to like why this happened in the first place? Because that's how you resolve problems. And like I said, United Healthcare obviously is not the only ones that are doing this, because that's an article about Anthem. And so it's something that really needs to be addressed, and something we really need to hold everyone as a country accountable for, whether it's the hospital, whether it's well, it's really not really the hospital, it's mostly the insurance companies. But they are more focused on their profit than they are on making sure that we as Americans who are paying both of these people, both the healthcare providers and the insurance providers, they are more concerned about their money than they are about our health. And I know that this was kind of rambly, and I apologize for that. But if there is anything you'd like to contribute, please do so. I like the comments that I read in the last video. If there's any more that you'd like to add, please let me know. But I will see you in the next one.